To beat a heart attack, you really have to start early. If you wait until your doctor tells you you have high blood pressure, or until a cardiologist that your doctor sent you to says, we have to do a test, then already you're starting. It's okay to wait. Regarding exercise, it's okay to wait until your doctor says it's time to start. But why wait until then? Or worse yet, if the doctor it's okay to wait until your doctor says, please start an exercise program, but why wait until then? Because most likely if he's telling you that, or worse yet, if the cardiologist is telling you that we have to do an invasive test to see how bad your disease is, it's going to be hard to start a new routine at that point in time. Because most likely you're going to be in your most likely you'll be middle age or older, and if you're not used to any form of exercise and this is your exercise routine, then the likelihood is you're going to have a harder time to get that ball rolling. So, and then inherently as you get older, there'll also be challenges as far as arthritis, working and develop arthritis, or blood pressure medicines that are holding you back, or cholesterol medicines, or other diseases that might be difficult to get started with. That might be difficult to design an exercise routine around, especially if you're doing it on your own. I always say that you have to get a coach involved, especially if you're not a gifted athlete from way back when. If all you know is going to the school weight room and exercising by lifting weights, it's probably a little bit, you're probably a little limited on the resources to find a sustainable activity. The idea is we have to have a knowledge base to experiment with different types of exercise. Okay, so your doctor has told you that you have to begin an exercise routine or get more active. Or worse yet, your cardiologist has told you you have to start exercising. Now, obviously this is not exercise. If you use the TV to play DVDs for motivation, inspiration, for yoga class, I think that's okay, especially if you're not going to get out and do anything, to be guided by a pre-recorded activity. But it does get a little boring. And when boredom sets in, sustainability will be cut in half. So I always want my patients to have something that's sustainable. Because if they came to me due to a problem, whether it's high blood pressure or high cholesterol or obesity or arthritis of the knees, back pain, anything, then the likelihood is that stuff or that bad lifestyle has been going on for a couple decades. So to start an exercise routine with a couple of decades of damage is tough. That's why I wouldn't wait till your doctor says, now you gotta do it. I would try to do it beforehand, but you know, we always have busy schedules and it's hard to kind of fathom that when you're feeling pretty good and not having any symptoms. Until every Christmas or every New Year's you have an extra 2 to 3 to 5 pounds weight gain. Before you know it, you're seeing your doctor for a checkup and he's saying you got this, this, and this. So, or you're just looking at your waistline or the scale in the bathroom and you're saying, how did I ever get to this point? So everybody should be moving. In fact, in the millennium, sitting is the disease that's equal to smoking from the 90s. In fact, in the millennium, sitting is our new smoking. In fact, nowadays, as far as diseases, as far as unhealthy lifestyle, sitting is the new smoking. So we're working on getting people to stop smoking and cutting down, and I think the government and industry has had great strides in cutting down the amount of tobacco exposure. But now the concept is if you're not moving, then you're gaining weight, you're stagnant, and if you're not moving, usually what happens is the diseases will come sooner or later. And again, when you start to feel the symptoms or when your doctor finds those things that are positive, it's really hard to get the ball moving at that point in time. It would be great if we can teach that stuff in high school and maintain it through college and maintain it through our middle-aged life, but priorities are always different with everybody. So until you come and see me and I have to tell you you have deficiency, you have disease, and let's get moving. But regardless, one of the ways that you can start moving is to understand how one of the best ways I've found to begin a new lifestyle change is to plan. It's not that hard. You can always plan. I always have calendars available because I think it's important to see where you're going and to have a projected course. If you know what the end game is, as far as you want to join a 5K walk or you want to do a mud run. I'm doing a Spartan run in 2016 summer. I'm doing a Spartan run in June of 2016, and it's just to keep my activities interesting. I always lead hikes. I think that's the new activity. The activities that I do now personally are different than the activities I did 10 years ago. It's because everything's dynamic, and although although priorities change, I think that you should have several different go-to activities that will be resonating with you for your age of life. If you stick with one type of activity, especially in Chicago, when the winter sets in, you're probably going to either decrease the activity or fall off the wagon sooner or later if you have nothing else to go to. So it's nice to, number one, have different types of activity. It's also nice to know how to advance. If you don't know how to take your pulse, if you don't own a pedometer, if you don't have one of the fancy watches that can calculate everything, then you don't need that stuff. You just have to understand how to start and then how to progress, how to maximize on your improvement or see where you have to push, and then to get to the next goal. One of the easiest things, I think the American Heart Association website, I think the website for the American Heart Association has very nice laid out plan for beginning an exercise routine, advancing an exercise routine, knowing where you're supposed to be. Everybody should know how to take their pulse. I've marked down where you usually put your fingers for checking pulse rate. You can do it right underneath the thumb into these areas here that I marked down, both sides. You can also do it with your neck, but it's not that wise, especially as you get older, to press on your neck too hard. Especially if you have plaques or cholesterol, you push the vein or artery and that'll set off a plaque. It's better to do it with the wrist. If you don't know how to do that, then get one of the fancy watches. They're not too expensive nowadays that will check your pulse. If you work out in gyms, with treadmills or stair steppers or elliptical trainers, they usually have two poles that you can grab and it checks your pulse that way. So it's nice to have a measurement, because when you have a measurement, you can advance. You can also throttle within the certain goals of the measurement to figure out where you are, what you want to do, where you want to be. So the rate of perceived exertion, again, you can find that on American Heart Association's website. Rate of perceived exertion is a great measurement to kind of figure out if you're working out hard enough, and then what you want to do to get into the next summit. There's a scale, and I'll see if I can put a link here to the website. It still is based on your heart rate, still based on a few of the parameters of what's called the Borg rating for perceived exertion. And usually if you do that, in fact, there's something called FITT. It's the frequency, the intensity, the timing, and the type of exercise you're doing. And if you understand or keep that if you keep that acronym in mind, you'll be able to figure out where you're supposed to start and what you're doing when you begin. You'll also be able to figure out if you're working out hard enough or what your goal should be. And it's always wise to have a coach or somebody from the outside critiquing you, because it helps you with speeding up your success rates. It also helps with avoiding injury. So you don't want to have a negative experience in your you don't want to have a negative experience when you're starting out a new lifestyle. So I understand when it comes to getting a personal trainer. Some people are hesitant, but I usually see that when you have a personal trainer, an exercise physiologist, a yoga instructor, martial arts instructor, a coach of some sort, I see faster gains with most of my patients. Sometimes you can even go to physical therapy or chiropractic too. Sometimes those two will be covered under the insurance, whereas what I mentioned before will be out of your pocket. But either way, as long as you have a set of eyes critiquing you and guiding you and giving you the best bang for your buck, you'll be able to get to your goal faster, I think. So the idea is to have a certain amount of measurements that you'll hit every time you go exercise. If you look at the American Heart Association's website, once you have those measurements, then you have to figure out what are the basic parameters for your decisions for how much exercise to do. And to beat a heart attack or to beat a stroke, usually you have to do 30 minutes, 5 days a week of moderate exercise, or 75 minutes, 3 days a week of vigorous exercise. Now, how do you determine? Again, you use the Borg rating of perceived exertion, and then you use the pulse rate that you get and calculate your maximum heart rate, and then you kind of fluctuate within a certain zone dependent on your maximal heart rate. Now, I think you can push the envelope. I always push the envelope to the maximal heart rate, but the amount of activity it takes for a new beginner to get to maximal heart rate will be minimal because you're out of shape or deconditioned. So your heart rate will go very fast, very quick. So you'll see as you get more, as your heart gets used to exercise, as your lungs get used to extracting oxygen out properly, as your muscles get used to utilizing energy properly, you'll have to do more to get the same amount of heart rate and perceived exertion. So that's when you know you're improving. One of the caveats I have when you're a beginner and you're doing it on your own is I think we can always get a certain level of I'm tired, and the inspiration to advance to the next level to get you to a good heart rate will be a little bit limited. So you always have, that's why you have to have goals. And again, you have to have variety. You don't have to be a yoga lover. You don't have to do yoga. You don't have to play team sports. You can certainly go throughout the neighborhood, do that typical parking far in the park. You can do the typical thing like parking far away in a parking lot, taking the steps instead of the elevator. All those things are important. But again, to get those measured, to get the measured amount of desire, to get the measured amount of exercise and activity you're supposed to do that statistically has been shown to beat a heart attack or to beat a stroke, you really have to measure out 30 minutes of moderate activity these 5 days a week. And a lot of my CEOs say they don't have time. A lot of my parents say they don't have time. Well, you can break that down into 10 minutes, 3 times a day, 5 days a week too. So there's a whole bunch of different ways to do it depending on it, and that's why it's so nice about, there's a bunch of different ways to do it, and you can tailor your design dependent on your activity, your work, your sleep, your shift work. But it's still important to have a design and to have a commitment to break some eggs or just experiment for a short amount of time. You'll find that a couple of the sports you enroll with or the couple of the activities that you do might not be something that resonates with you. Well, you put that one away and you try the next activity. You just can't say you're going to do hiking and it didn't work for you, so you didn't go into anything else. You have to have a fallback. And it's expected. Sometimes you get injured, sometimes you get really busy with work or life, and it's just a matter of when you do miss on that 30 minutes a day, 5 days a week, if you miss on one of the days, you have to try to make it up somewhere else in that day, whether you do extra walking, whether you go to the mall, whether you take your dog for a loop 3 times instead of 1 time, whether you bundle up your kids and take them for a brisk walk. Whatever you do, it should be, or even having a meeting, walking with other folks instead of talking on the phone or talking in a hall or talking. If you have a walking meeting at work, that would be a way to make up the difference if you missed your window of opportunity for that day. But it still has to be a commitment. And when you have it on the schedule or when you have it on the calendar, it makes it very tangible to say that now I have to keep up with this because I missed a couple of days. I got to put in I have to make my 150 minutes a week of moderate exercise. So those are the parameters that I always tell my patients to go with. If you fall back and if you falter and you can't get to the first summit, then that's when you really need, if you falter and you can't get to the first summit of just experimenting and finding a groove of some sort, then that's when you have to really invest in asking for somebody or searching for somebody. You can go to the American College of Sports Medicine, and we have with the ACSM, there's certain levels of trainers or personal fitness instructors that you can get with experience. You should also research the folks in your area, the park districts in your area, to see there might be a discount available for you, or there might be a Groupon available for you. This is meant to save money. The idea is you're going to beat the heart attack or the stroke that's coming, but you're going to have to you're going to have to invest either monetarily or in the form of time and sweat to get to that point. I remember one of my colleagues said she doesn't like yoga because she sweats. And there's no way around it. You're going to have to sweat to get this exertion going. You're going to have to breathe heavy. You're going to have a fast heart rate. You're going to have a little bit of muscle soreness, but no burning. And that is the delicate balance that if you're unsure of how to push, you can really fall off the edge. Or if you have a disease process, say you have cardiomyopathy already, or say you have fibromyalgia, you have a lot of trigger points, you have a lot of neck pain, you have a lot of chronic fatigue, that person also has to tailor their activity or entrance into activity because they can really crash fast. There's something I've mentioned in my previous videos of push-crash. It's when you go a little bit too hard and then you crash because of injury or setback. A lot of people with chronic fatigue or fibromyalgia, when they push too hard, they'll feel like they have a viral infection, or all the trigger points will snap up, or they'll become more depressed, or their sleep will be off. So when they crash, it's very discouraging, but that's why it's important to learn, instead of push-crash, to just overload and repair. But that's what I love about my athletes, because they don't push and crash. They usually just overload enough to either the heart muscle or the skeletal muscle and to cause stimulation to rebuild in about to cause enough damage and stimulation to the muscles. They overload to the point of a little bit of stimulation and inflammation. My athletes overload just enough to stimulate that inflammatory response that gets the muscle or the cardiac rhythm to become stronger in 2 days, especially if to become stronger in 24 to 72 hours, especially if that person is also buying into proper sleep, proper nutrition, proper hydration. So it all links back into each other. So those of you who are trying to just lose weight with nutrition and not buying into the exercise or the mindful relaxation practice, it's okay, because that's probably where you are now, but you're going to have to invest in that sooner or later. That's why. So the end result, so your end goal or your summit, the ultimate summit, is going to be staying alive till 90 and being very productive, being very happy, and being with family. So the end result is always, in my opinion, the end result is always to get to 90 years of age, be joyful, be active, be involved, and contributing back into society to get others inspired as well. Now, between whatever age you are, and getting to that point, it's a couple of decades probably, but it still takes a little bit of planning. If you keep that in the back of your mind, even with the investment, even with the initial investment, the likelihood is you're not going to need as much co-pays for specialty visits with doctors. You won't need as much co-pays for prescription medicines. You won't even have to have, all you'll have to do is maintain an annual physical and get by until the next year, because your doctor's going to find that you're hitting all the numbers and you're fine. Versus seeing somebody every 4 months, every 3 months, getting expensive blood tests, having to hit your $5,000 deductible because you're still trying to catch up to all the diseases and you're still trying to catch up in taking care of the multiple diseases you have or multiple deficiencies you have that aren't covered by insurance. The final thing would also be that you not only get your life into a good groove, you also get your partner's life into a groove, you also get your partner healthy, and you also get your kids inspired to see where they want to be versus where their colleagues are. Because the unfortunate fact is that 2 in 3 Americans are overweight and moving into metabolic syndrome. Metabolic syndrome is a high hip to waist ratio. Metabolic syndrome is a high hip to waist ratio, elevated blood pressure, elevated triglycerides, elevated cholesterol, hypertension, and then that usually leads to expression of disease within 5 years. The unfortunate fact is that 2 in 3 Americans are obese, 1 in 2 kids are obese, and that usually, if unchecked, 1 in 3 Americans is obese, 2 in 3. So the unfortunate fact is that 2 in 3 Americans are obese, 1 in 2 kids are obese or overweight. That leads within, if unchecked, that will within 5 to 10 years lead to prediabetes, which again, if unchecked, within 5 to 10 years will lead to full-blown diabetes. And again, that leads to a heart attack or stroke or cancer expression. So disease will always progress on because age always progresses on, but I don't think you have to be a slave to think when you get old you're going to be arthritic, you're going to be dependent, you're going to be having to wear diapers. I think that's the American thinking of being old. But if you go to Europe or Asia, we have a lot of elderly that are active, still involved in the family, and not yet in a nursing home. So I think that's one of the things we have to look forward to instead of just getting old and retiring. Instead of just retiring, getting old, lonely, and frail. I'd always say push the limit as far as what the human body can do, and you'll be happier and everybody else around you will live longer.